So welcome everyone to the 2022 Family and Youth Services Bureau Runaway and Homeless Youth Program Specific Training Series. This is the first of our series and it's focused on transitional living programs, or as we lovingly call it, TLP. Before I introduce myself, I have the pleasure of introducing FSB's new Associate Commissioner, Kimberly Waller, to officially welcome all of you to today's training. Kimberly, if you're there, take it away.
Wonderful. Thank you so much, Tiana. It's so wonderful to see everybody here in this virtual space. I have the very big honor of welcoming you all to the 2022 Runaway and Homeless Youth Program Specific Training Series. As Tiana mentioned, my name is Kimberly Waller, and I've recently rejoined the Family and Youth Services Bureau as the Associate Commissioner. A little bit about myself. So throughout my career, I've had the privilege to serve in various federal, state, and local roles that focus on ensuring safety and stability for all children, youth, and families. And as I previously mentioned, I'm rejoining FSB. It was during my initial time with FSB as a policy advisor from 2016 to 2018, where I learned firsthand the vital importance of our RHY programs to prevent and respond to youth experiencing homelessness. I'm super excited to be back, and I'm already really motivated daily by the impactful and transformative work accomplished by all of you, our grantees, and our fantastic RHY team. And I wanted to take a quick moment while I have you all in this virtual space to just share some of the priorities that I've shared with my FSB colleagues since rejoining. And so there are 4 of them that I wanted to just give a quick overview. And so FSB believes in the importance of coordination and collaboration efforts across federal, state, and local partners. Working together will ultimately allow us all to accomplish more than what we can do alone. The second, FSB is committed to ensuring that our work is grounded in equity and inclusion. In February, aligning with Black History Month, FSB launched an initiative to develop a FSB Racial Equity Action Plan. We know you have been engaged in similar efforts within your organizations across the country, and we're really excited to drive this work forward with you. The third, FSB will lead in partnership with those who have lived expertise and who have participated in FSB programs and services. Lifting up all voices who have the knowledge and experience to guide FSB's ongoing work to address and respond to homelessness and housing instability is truly our path forward to finding solutions together. And lastly, FSB will drive our work using a data-driven decision-making approach. Policy development and programming must be influenced by data and outcomes. Services should be responsive to the needs of our communities, and we must track outcomes to highlight what is working well and rethink what may need to be changed. So those are really the 4 that I've talked with my fellow RHY colleagues, and really excited to see what this training has in store for you all today. And so many of you are already doing so much that fits within those priorities. So again, I have the privilege of welcoming you today to this great opportunity to develop new knowledge and skills for delivering RHY programming. We really have a great lineup of presenters and sessions, and our time today is structured to provide really a balance between presentations, grantee spotlights, which are my personal favorite, and of course, group breakout discussions. And although, of course, we are in this virtual space, really encourage you to be active participants in our training activities. There's so much knowledge that you all have to share amongst yourselves, and really excited for that virtual opportunity. These trainings provide an opportunity for each of you to share your newfound knowledge with your colleagues and apply that downstream. So take what you learned today, and if you attend future series, take that knowledge and share it with your colleagues who may not be able to attend this virtual space. And of course, this ultimately will result in your program participants and the young people who are benefiting from RHY programs to be the greatest benefactors of our collective efforts here. So, of course, I'd really like to take also a moment to recognize our RHY training and technical assistance partner, Youth Collaboratory, for their partnership and expertise in hosting these sessions. There's a lot of work that goes into planning and logistics of these types of events, and really appreciate your partnership. And in addition, would like to really extend my thanks to all of our grantees and to this incredible RHY team for your work in coordinating and planning this event. Your compassion, dedication, and commitment is very evident, and it really continues to have a lasting and positive impact on young people's lives. once again, thank you very much for your time, for being here, for sharing your expertise, and really looking forward to working with you over the coming years while I serve in this role. So I will kick it back over to Tiana Williams, and thank you, Tiana, for all of your work, and she will provide an overview of the agenda to come. So thank you.
Thanks so much, Kimberly. So hello again, everyone. I'm Tiana Williams. I'm a program specialist within the RHY Central Office, which is located in sunny Washington, D.C. I would like to take a quick moment to ask my regional colleagues who will be facilitating today's training along with me to introduce themselves. So I will pass it on to Tom first. So Tom, if you're there, take it away.
Hi, thank you. Tom Bonington. I'm the project officer in Region 10, which is our Seattle office. We cover Alaska, Washington, Idaho, and Oregon.
Hi, I'm Rachel Francis, and I am the Federal Projects Officer for Region 7, which is Missouri, Iowa, Nebraska, and Kansas.
Hi, my name is Maya Herring, and I am the Program Officer for Region 8, which is Colorado, Montana, Wyoming, Utah, North and South Dakota.
Hi, I am Asita McGee. I am the Federal Project Officer for Region 2, covering New York, New Jersey, Puerto Rico, and the beautiful and sunny Virgin Islands.
Oh, and I'm Jenny Weiser, a youth program specialist at FISB RHY Region 5 in Chicago. We covered the states of Illinois, Indiana, Ohio, Michigan, Minnesota, and Wisconsin.
Hello, I'm Jessie Bolivoy. I'm a federal project officer with Region 3, Philadelphia, and we work with Pennsylvania, West Virginia, Maryland, DC, and Delaware.
Hi, I'm Rebecca Eichelberger. I cover Region 6, which obviously is, you can see on the screen, New Mexico, Texas, Oklahoma, Arkansas, Louisiana.
Hey everybody, I'm Tim Joyce, and I work in RHY Central Office in Washington, D.C.
Hi everyone, good afternoon. My name is Jessica Drazanovich, and I am Federal Project Officer, and I work in Region 1. So I work with grantees in Vermont, Massachusetts, New Hampshire, Maine, Rhode Island, and Connecticut.
Great. Thank you, everyone. So that leads us to our first poll. I see a lot of introductions that are going on in the chat. So thank you. If you haven't done so already, please introduce yourselves with your name and organization in the chat. Our first poll is an easy one, and you have a slide to help you out a bit. Can you please tell us what region your organization is located? And there's no pressure, but we have some bragging rights on the line for our FPOs to see who checks in at the highest. So if everyone can take a moment, we'll just have this up for about 20 seconds or so. Awesome. And I think we can officially close the poll. And it looks like, oh, Region 5 has the most folks checking in. So Nikki, Jenny, Danielle, Jeremy, awesome job. There are 3 more trainings to go, so there's still room to redeem ourselves, which is great. So first thing, I'm gonna go over a few quick housekeeping items for today. The first one being, please ensure that your microphones are muted. Thank you so much. It's a little distracting to hear background noise while we're presenting, so just be sure you look down at the bottom of the screen to make sure your microphones are muted. Next, we do have a bunch of information to cover today in a very small window of time. So if you'd like to participate by asking a question or providing a comment, please use the chat feature, and that is on the right of your screen. We will be monitoring the chat and answering as many questions as possible during the live training. We also plan to provide a transcript of the questions and answers, along with links to resources to everyone in attendance today. And now, along with that, you'll also be getting a copy of the slide deck. and a link to RHY's e-learning system. And so just to do a plug, please be sure that you are subscribed to RHY emails and sign up for the e-learning system so you can stay informed and connected to everything RHY. And next slide. Awesome. So let's talk about what to expect for the next 4 hours today that we'll be together. First, you'll be with me for a little while longer to talk through the purpose and objectives for today. Then we'll talk about commonly used terms before moving on to the TLP program vision and legislative authority with Jesse. Maya, Jenny, and myself will dive deeper into program requirements. Rachel will discuss performance standards, and Asita will walk through administrative and national requirements before we go into break. And after the break, we're going to be moving into randomly selected breakout groups to discuss either aftercare, partnerships, or data collection. Now, you received an email from RHY prior to today's training with the breakout questions, and our goal was for you to have an opportunity to look at those questions beforehand and to be able to gather your discussion ideas, think about lessons learned from your experiences, or anything you'd like to discuss related to those topics. So you will see what breakout group you're going to go into after we get back from break. And throughout all of these trainings, all of our training series, we will also be highlighting some of your fellow RHY grantees. Now, we recognize that all program requirements do not come easy, so we thought it would be helpful to talk through those difficult requirements and highlight grantees who've been able to find innovative ways to achieve them. Now, this does not reflect all of the great work that's being done in the field, but we selected a few grantees to give you an opportunity to hear about your colleagues and connect with them if you feel that their strategy could work for you. Next slide. So our goal for today and the rest of the training series is to talk about RHY program-specific requirements. So we'll review elements of the program, talk about best practices, and provide resources to help you to continue implementing your programs well and even make some program improvements along the way. Next slide. Next slide. But before we get into definitions, I do want to go through the objectives of today. So we want you to walk away with a few things. First, a better understanding of the TLP program requirements. We want you to learn new ways to improve and enhance your programs. Of course, develop skills when working with the young people that you work with every day. And of course, connect to colleagues in your field. As Kimberly mentioned, we really are nothing without one another. So connecting like this is so important to our collective success. Next slide. All right, TLP definitions. So you may be wondering why we want to review definitions today, but we felt that it was important to review key terms that you'll be hearing a lot throughout the day today, and also talk about what they mean specifically in terms of TLP. Next slide. So the first set of terms really relates to the young people that we serve, right? Runaway and homeless youth. So if we break those down, runaway youth are those young people who leave from home or their legal place of residence without permission from a parent or guardian. Homeless youth, in terms of TLP, refers to youth who are age 21 or younger, who have no safe living arrangement and cannot live with a parent, guardian, or relative. Now, a subset of that term is street youth, which refers to runaway or intermittently homeless youth who spend a majority or significant amount of time on the street or other areas that put them at a higher risk of dangerous circumstances, such as sexual exploitation, trafficking, prostitution, or substance use, to name a few. Next slide. So these next set of terms are housing-related terms that you may hear many times throughout today's training. So shelter is a common word that you see within RHY regulations or TLP program requirements. And many people hear the word shelter and they think of a typical shelter structure. So a large building, multiple beds, multiple rooms. When we're talking about TLP, shelter refers to any housing type or structure being provided to a runaway homeless youth. So this can be a licensed women's shelter, a group home, a maternity group home, a host family home, or a supervised apartment sites. Those are all referred to as shelter in TLP speak. Now, stable housing is a goal. We use this term stable housing when we discuss our overall program goal and vision. We talk about this when we talk about safe and appropriate exits. Stable housing for a youth is one that is safe and secure, a place that a youth considers home where there's no uncertainty about their ability to remain there. I worked in child welfare for 10 years, and one thing that has always stuck to me is that the young people that I worked with that were in TLPs just stressed how important it was having a key to their apartment, a key to their room. It not only meant that their belongings were safe, but they also felt safe as well. Now, the last term on this slide is host family homes, which are family or single adult homes that provide shelter to runaway homeless youth. Next slide. So we'll spend a majority of this training discussing program requirements that are expected as a part of TLP. These slides that we're going to be going over from this point on are all program requirements that will be discussed further in later slides. So first up is case management and treatment plans. Case management really involves determining the needs of the youth you're working with and develop a plan to identify, connect, and monitor the appropriate services to address those needs. Now, this involves very consistent contact and follow-up to ensure these activities are in place. Now, treatment plan, ideally done in collaboration with the young person. Treatment plans are written plans of action outlining the youth's strengths and needs and determining a strategy to tackle those goals. So plans typically address both physical and mental safety issues. And ideally, any of the treatments or activities recommended as part of the plan should be at a minimum trauma-informed, evidence-based, or evidence-informed. And we can go to the next slide to talk about what those two terms mean. So evidence-based practices, or you may hear EBPs a lot, is a term used to refer to approaches to prevention or treatment that are validated by documented scientific evidence, which is important. So this includes findings established through controlled clinical studies, for example, and EBPs consider the unique needs of the client, and if used consistently, optimal outcomes are more likely to be achieved. Now, differing slightly is evidence-informed practices, which integrates the best available research and practice knowledge to guide program design and identify and deliver services. Now, informed practices allow for more innovation while at the same time incorporating the lessons learned from existing research literature. Next slide. So moving on to outreach. Outreach refers to finding and engaging with runaway, homeless, street youth, or those who are at risk of falling into those categories, and really bringing awareness to them about available services and resources to assist them. Now, some of those services can include what we call gateway services, which refer to immediate, tangible things like food, drink, clothing, hygiene products. These items meet the basic and immediate needs of youth and can be used to actually build trust and rapport between a youth and the outreach worker. Next slide. Now, moving on to aftercare, that refers to the period of time following a youth's residential stay with the program. And during this period, programs offer a continued supportive relationship with the youth to ensure his or her safety and stability. Now, for TLP programs, they're expected to provide aftercare for a period of 3 months. Safe and appropriate exits for a youth leaving from TLP could look like an exit to an independent living program, a residential apprenticeship, higher education, military service, or other destination with positive opportunities. An emphasis on positive opportunities here. An exit from TLP to the street or to an unknown location or a homeless shelter is regarded as an unsafe exit. Next slide. So I'll wrap up this portion in talking about permanent connections and social emotional well-being. So permanent connections, as you'll see by the definition, it refers to lasting relationships to family, adult role models or mentors, community, school, or other positive networks that provide a safety net to help youth continuing to thrive in a positive direction. So the need for connection and support during transition to adulthood is incredibly important for any of us, but especially for the youth that we work with. And TLP programs are expected to work with youth to establish these connections prior to program exit. Social and emotional well-being is really talking about a youth's capacity to develop the skills, attitudes, and behaviors to avoid unhealthy risks and succeed across daily life domains such as education, employment, interpersonal relationships, and within the community. So now that we've reviewed all of these terms that you're going to be hearing about through today, I will pass it off to Jessie to discuss the goal, vision, and legislative authority of TLP, which is really the basis of our program.
Thanks, Tiana. Next slide, please. So I'm just going to briefly talk about the TLP vision and goal. It's really just to help frame this training. Really, the intent is to provide a temporary safe net and strong emotional support system for young people to transition into self-sufficiency. This is really the important work that you all are doing on a daily basis, but I really just wanted to emphasize that that's what we're looking at as we're going through all these slides and talking about examples and discussing, going back to this goal and vision is really important. Next slide, please. And the next. So the other portion is the legislative authority. So as a new FPO, I started just 6 months ago. I actually find this legislative authority interesting since it's so much more recent than some of the other federal programs for children and families and programs that I've worked with before. So this is, as many of you know, a 1998 amendment to the RHY Act. And really, it was just made clear from the previous work with the BCPs that there was really a growing need for long-term supportive assistance. So in 1990, the first TLP programs were funded, and we're going over about 30 years plus funding your important programs. So with that, I'm going to hand it over to my amazing colleague, Maya, in Denver to go over the next portion.
Hi, this is Maya, and I'm going to talk through some of your project requirements. So we have a couple of categories. Safe and stable shelter is the first one. Next slide, please. Next slide, thank you. So TLP programs have an opportunity to provide services for up to 18 months, which is 540 days. Or in exceptional circumstances, 365 days. And that is also unless a youth has entered prior to their 18th birthday, then they can stay through their 18th birthday. And what we're looking at in terms of housing models is host homes or supervised or scattered site apartments or congregate care group type homes or shelter spaces. So it can look really different in different communities. And in terms of shelter or housing capacity for all TLP programs, we're expect folks to have a minimum of 4 and not more than 20 individuals in that space at once. Next slide, please. So we require that TLP programs provide on-site direct supervision at the facility as long as that's not a family host home, because in a family host home, we anticipate that the family is providing that supervision space. And that TLP facilities have a youth to staff ratio that ensures that all homeless and runaway youth are receiving adequate supervision and services. Next slide, please. When there are situations where there is not an available opening, we expect that TLP programs will work to find an emergency shelter placement for youth where that's appropriate, and an age-appropriate emergency shelter. Next slide, please. We expect that TLP programs will do staff training so that staff are aware of how to engage with victims of trafficking or understand trauma. We have a whole host of trainings that is sort of best practice and what we would look for programs to do with their staff. That includes core competencies of youth workers and a number of different trainings, and RHY has a list of a kind of core set of trainings that we expect programs provide to staff. Next slide, please. So another area is just in terms of services. So we expect that TLP projects will work to ensure that youth are engaged in educational advancement or job attainment skills, or are working while they're in the program. And so this is a point where we want to highlight one of our grantees. So this, next slide, please. Mountain Home Montana is a TLP program that is operating a maternity group home model, and they utilize a supportive employment program for the young moms in the program. This was an intervention that was developed at Dartmouth as evidence-based, and it essentially, when moms come into the program, within 3 months, they start working with an education and employment coordinator that works with community businesses and develops long-lasting relationships. For example, in October through December of 21, they made those coordinators made 116 contacts in the community of Missoula, where this program is. This program operates under 8 core principles, of which there is a 0 exclusion eligibility, meaning there really isn't a situation where a young person would be excluded from participating in the program. Some of the other principles include a rapid job search, a competitive employment, systematic job development, client preferences. So they're working with something that's going to be a good fit for the mom and the job that they will have. Personalized benefits, integration of mental health services, and individualized support. So this is just one example of a way that a program is really investing in what it means to do supportive employment work with young people in the program. Next slide, please. So safe and appropriate exits is another component of the TLP project. Must ensure that when youth are leaving, that they're going to somewhere that is safe. And I'm going to turn this over to my colleague Jenny, who's going to highlight another grantee that demonstrates safe and appropriate exits. Jenny, take it away.
Thanks, Maya. So my name is Jenny, and I'm going to go ahead and highlight Connections for the Homeless as I talk about safe and appropriate exits. Connections for the Homeless is a TLP program in Evanston, Illinois, and they are actively involved in the Youth Homelessness Demonstration Project. Basically what it is, it's through the Alliance to End Homelessness in the suburban Cook County, was awarded this grant, the Alliance, to create an end plan to end youth homelessness for youth under 25 years old. And through this, partners in the suburban Cook County, including Connections for the Homeless, are a huge part of this plan. And really, it's just to learn more about the experiences of youth homelessness, to develop approaches and solutions that better meet the needs of complex needs of youth and young adults, and to expand that availability of services in an equitable way. So it's really through leadership and vision and cross-sector collaboration to end that youth homelessness. And if there is youth homelessness in the community, it'll be brief, it'll be rare, it'll be one time. It's again to ensure that youth have immediate and equitable access to everything they need, from housing to education, employment, and well-being, as well as positive connections. Next slide, please. So Connections for the Homeless, which again is part of this youth homelessness demonstration project, has launched and implemented, in addition to their TLP program, has so many wonderful other housing programs to ensure that the homeless youth are self-sufficient and stable and have that permanent housing, which includes transitional housing units, rapid rehousing units, and so forth. And in addition to the housing, they also receive case management skills, employment, school, mental health, life skills, so many things to ensure they have that stable and consistent housing through all those variety of choices. And through those choices, it ensures that they meet those individual needs and they successfully graduate and exit from program within their agency to program, and that they get that so safe and appropriate exit strategy, and it's choice-based, and it's consistent and stable housing to ensure their personal growth, and they have many different presenting options. Next slide, please. And now I would like to share the comprehensive youth-centered services model, which is another requirement under the TLP program. Next slide, please. So one of the requirements is social and emotional well-being and trauma-informed care. This is embedded in everything that, as you know, the TLP grantees do to ensure that that youth have trauma-informed delivery, service delivery in all aspects, from building trust and building those relationships to all the core case management, all the services, all the way through aftercare, that it's all trauma-informed, and it's all ensures prevention of re-traumatization. And this happens that staff get lots of trauma-informed training, and they learn how to deliver that down to everything, all those aspects within the trauma-informed care model. So it's in everything that they do to reduce those behavioral and mental health consequences of trauma. Next slide, please. And one more thing I want to share before I turn it over to Maya is that in that trauma-informed care and social emotional well-being, it's about the youth finding a path to thrive and not just survive. And now I'd like to turn it over to Maya to talk about and highlight the social emotional well-being spotlight of her grantee. Thanks, Maya.
Hi again. So Salt Lake County Division of Youth Services has a program, the Milestone TLP program. And we're highlighting them in this section because of what they've done around social and emotional well-being. So part of it is that this program has a dedicated therapist that is dedicated to the TLP. They have four homes that they work with. Youth live in congregate care settings. For the most part, one is an apartment building fourplex. So they have a little bit of separate space. But what the program has done is really dedicated staff time, put resources towards staff being trained in this particular curriculum. And really what they did is revamp a couple of different curriculums to fit the needs of the youth that they were seeing in their program. And so Mind Matters is kind of the core of it through the Dibble Institute, but ultimately what makes this successful is that it's normalized as part of the program that you participate in the groups twice per month on Sundays, as that's when most can attend. And they are focusing on teaching coping skills, mindfulness, self-care, and have really seen a difference in outcomes based on this dedication to working the curriculum with staff and youth and the therapist together. So, all right, I'm going to pass it back to Jenny. Thanks, Jenny.
Thanks, Maya. Next slide, please. So now I'd like to talk about the next requirement, which is the service coordination plan. Want to ensure the TLP programs do such a great job of working with so many partners to ensure that the youth are referred to whoever is appropriate based on the assessment of their needs. And really the TLP grantees ensure that those care services are accessible and that the youth can then grow and get what they need. So this is everything from referrals with social services, with law enforcement, with the McKinney-Vento liaisons, vocational programs, GED, colleges, apprenticeship programs, legal services, anti-trafficking organizations, healthcare, childcare, and so forth. There's so many different programs that the TLP programs must coordinate with and ensure that those youth get those comprehensive services. And a lot of times these could be through signed MOUs, through linkage agreements, and through just good old-fashioned referrals. Next slide, please. The next requirement I'll discuss is the Positive Youth Development Framework. And this is embodied in everything that the TLP programs do. Is really that Positive Youth Development Framework is to ensure that youth have positive adult role models, that they're hearing healthy messages, they feel safe, and in these structured places, they're learning skills, they have opportunities to contribute to others, and they have everything they need that's very intentional and pro-social. So it helps youth engage in their communities, in their schools, in their peer groups and families, and through the organization itself. It's very productive and constructive. It's about leadership, and it's about enhancing the youth's skill sets in so many ways, and it helps them in all parts of their life. Next slide, please. And now I will highlight in the Positive Youth Development requirement is the Night Ministry. The Night Ministry is located in Chicago, Illinois, and they have a Youth for Truth group, which is an amazing group. It's a youth leadership development program for youth ages 18 through 24. And really, this youth development program empowers young people to build their life, to learn job and advocacy skills, and help them elevate their youth voice while in the Night Ministry program. They work on their professional goals or personal goals, but they also work on community goals and actions and projects while they're getting to know the different programs at the Night Ministry. Their youth voices are sought, they are engaged, and they're heard from outside entities as well as through their staff within the Night Ministry. These are youth 18 to 24. They're willing to be a team player, and they work part of as a group. And really, these are learnings that have dedicated staff that help them be successful. They compensate youth for their time. They benefit the agency, and this impact will build over time. Next slide, please. The next requirement I will talk about is the outreach plan. And the outreach plan is just simply the TLP programs just develop a plan to find those RHY or street youth wherever they may congregate to ensure that they get the services that they need. Next slide, please. Public outreach and awareness is really just ensuring that the TLP programs has a plan to raise awareness about the TLP program in their communities, whether it's through social media, through public service announcements, through collaborations with so many organizations, including the National Runaway Safe Line and so many others in their community, such as anti-trafficking organizations, law enforcement, healthcare providers, mental health providers, other stakeholders. There's just so many pieces involved in raising that awareness. And there's so many great examples out there of TLP programs raising their public outreach and awareness from using social media, such as Facebook, Twitter, Snapchat, videos. They use QR codes to scan services so that the youth can get that immediate access to learning about the program. These TLP staff, in partnership with youth as well, attend community events, could be homelessness awareness, resource fairs, job fairs, just so many different Homeless Connect, Project Connect. They present on their services to roll calls through law enforcement, through the McKinney-Vento liaisons, and so many other strategies to raise awareness in the field. Next slide, please. Gateway services is just that immediate service that the TLP grantees do such a great job of when they find those RHY youth wherever they congregate out there, whether it's couch surfing or whether it's in the schools or whether it's in their community. They provide that immediate food, drink, clothing, those hygiene products, those wallet cards, the pocket cards that have the National Runaway Safe Line hotline, the trafficking hotline, their own immediate hotline if they have, so forth. And they sometimes with their food and their drink, they're very creative. They put in their water bottles, they put logos in there, pens, pencils, drawstring bags, they'll use their logos. So whatever it takes to draw these TLP youth into their program and help them build that trust. Next slide, please. Screening and assessment, TLP grantees do a great job of using so many different screening and assessment tools out there to assess the eligibility, ensure that these are meet the definition of homeless youth and with the age criteria and all the different factors to be in their program and to meet their immediate needs right away. And there everything from Ansel Casey life skills assessments to the ACE adverse childhood experiences and trauma for screening assessments, human trafficking assessment tools, the VSPDAT, housing prioritizing screening assessment tools, just so many examples out there of just such great tools to assess their eligibility. Next slide, please. Case management. Again, another kind of key requirement is to really the TLP programs ensure that when they work with the runaway and homeless youth, they provide that package of services. And really that package of services is based on those needs of the youth. So that package of services to meet those requirements, is everything from the comprehensive case management, educational services, career readiness programs, referrals for employment, mental health, substance abuse, rental assistance, housing vouchers, life skills, financial literacy, whatever those youth need to ensure that they transition to self-sufficiency is all in that piece of advocacy package that the case managers arrange and coordinate in partnership with the youth. Next slide, please. Now, the individualized service or treatment plan is just taking it one step further in terms of that package of case management services. It's embedding it all into that individualized service or treatment plan. That's that written service plan that's based on the youth's individual short-term and long-term goals. They can be evidence-informed, and really they are set up to help that TLP youth sustain sustainable living. So those are developed in partnership with the youth. It's all about positive youth development. They focus on those 4 core outcomes of safe and stable housing, social and emotional well-being, permanent connections, and self-sufficiency, all embedded within that individual service or treatment plan, which can focus on who's responsible, what are the action goals, what are the steps, how will it be carried out, and what are the outputs and outcomes. All could be in part in that service plan. Next slide, please. Now, record keeping and case management, this is both for, it includes the young person's infant or child, which a TLP program can have, if applicable, a child or an infant in their program. But those files are kept so that all the documentation is clear and organized. And a lot of times the grantees will have checklists, they'll have quality assurance checks, they'll have like kind of different people double checking just to make sure everything is not just said, all the great interventions and all the great work is being done, but it's all being documented and it's all very clear from intake and case management to the case plan, to the progress notes, all the way through aftercare. And if there's infants or children involved, there's also records of well care visits, sensory developmental screenings and assessments, all should be part of that record keeping and case management. Next slide, please. Transitional planning really goes together with the treatment, the written service planning. It's also ensuring that in order to help these youth be safe and stable after their program exit, it's taking it one step further, is also making sure they have all their important required documents, social security cards, state IDs, driver's license, medical records, educational records, whatever they need. The staff do such a great job of in helping them support and navigate those systems so they can get those important documents to be successful after program exit. Next slide, please. And finally, for my requirement under this model is aftercare plan. And the aftercare plan is really just to ensure that youth have those safe and appropriate exits when they leave the program. So it's really just to help them set up to, again, all in partnership with the youth. It's all about positive youth development, helping them, the staff engage with these youth. They partner with the youth and other agencies, sometimes in the communities, to help those youth maintain contact when they're part of that aftercare of a minimum of that 90 days or more. They help them, the staff, overcome barriers and to be successful, whether it's mental health or affordable housing or life skills or rental assistance or whatever they need to achieve their goals and prepare for the exit. And the staff are so wonderful in terms of providing all those supportive services to help them achieve those 4 core outcomes we had discussed. And now I would like to turn it over to Maya. Next slide, please, who will spotlight Mountain Home. Thanks, Maya.
Thanks, Jenny. So in relationship to transition planning as well as aftercare, one of the programs of Mountain Home Montana is that they're involved in an open table. And so any mom that is interested gets a table of 6 to 8 volunteers that meet at least weekly. This was started prior to COVID. So at first they were meeting in person, and through COVID they've done virtual meetings. And this is really a way to help the moms as they're transitioning out of the supported services of the congregate care setting or the individual apartment and really into their own independent settings, that the open table table friends and partners help provide different supports and services that the moms might need, and are a sounding board. In addition to the setting up the table, Mountain Home has a dedicated staff that works with these tables, but they did talk about at times there is a challenge with folks maybe wanting to engage with the moms a little bit differently. And so that is sort of an ongoing training place that they need to work with the volunteers. But by and large, it's been incredibly successful for Mountain Home with the moms feeling like they have a support network. So what they also recognized, and next slide, please, is that the minor children of the moms in their program needed some supports as well. And so they're partnering now with Friends of the Children, and there are Friends of the Children locations in various cities across the country. But what this group does is provide a paid mentor to work with a child beginning at around 6 years old and older, who have either faced significant trauma or systemic obstacles. And they provide that mentor for 12 years for the child. So this was an opportunity for Mountain Home to recognize that not only do our moms need support, but their minor children as well. And so this just allows for that to continue for significant time beyond the time that they're in the program. And I will turn it over to Tom for a poll question.
Thanks, Ma, I appreciate that. We have a poll question here about what's the most frequently used method of contacting youth during your aftercare within the agency. And if you could go ahead and take a second to fill that out and submit it, that would be great. We also have, as a follow-up to that, a chat question. Next slide, please. Follow-up is, what makes that method the most effective for you? And that's a chat question because we didn't want to narrow your ability to answer effectively for your agency. All right. And so now I'm handing back to Tiana.
All right, I'll give folks a second to continue to put their chat answers in there. And it looks like, Tom, texting is actually the most frequently used method to contact youth in aftercare.
Yeah, texting and phone.
Very interesting. Wow. All right. So I see, oh, got some more texting that was put in the chat. Great. And so while we let the last bit of chat responses come in, just want to put a reminder out there and reassure everyone that I do know, we all know that we are going through a lot of information in a short period of time, but not to worry, because you will get a copy of the slide deck. You will also have a link to the recording, and we are also taking down all of the questions that are coming up in the chat box, and we'll be able to answer those and send that out to everyone who participated today. So just wanted to put that reassurance out there to everyone. So I will move on to sustainability planning. Next slide. So as you'll read, I mean, as an RHY grantee, you should be planning for sustainability from day one, from the start of your project, and throughout the course of your project, you should be prepared to revisit and revise that plan whenever necessary. So your sustainability plan would include three things: diversification of funding, accountability to the 4 core outcomes, and collaboration. So diversification of funding, in simple words, is to expand your resource pool, right? So in the event that FISBE funding is lost, it's important that your organization has alternative funding in order to avoid staff loss or interruption to your program. Now, related to that, you should also, really be able to address how your organization will continue to support the program as well as the youth within it if you're met with staff retention retention or staff turnover barriers, which we know, has come up and has been an increased issue. In terms of accountability, what's a program without results, right? So when we discuss meeting the 4 core outcomes and measuring performance standards, the reason for that is being able to show programs' effectiveness. So relating this to the previous bullet on building a diverse funding stream, people want to know how impactful your program has been in reducing youth homelessness in your area and, further, supporting why they should make the investment with you if you're asking them to. Now, with collaboration, we'll be talking a lot about collaboration and partnerships in a few of our breakout groups. And it's pretty self-explanatory on how important it is to build a network of partners, especially in this work. So having meaningful partnerships not only provides possible financial supports for your programs and their financial stability, but it's also important in being able to connect you to services, to be able to connect them to resources, and provide them with a supportive network of peers because they need that to be successful. So the main takeaway from this section is really, getting an understanding of just how much these 3 pieces intersect with one another and they share a common goal. So I will pass it off to my colleague, Rachel, who will be reviewing performance standards.
Thank you, Tiana. So we are going to talk about the 4 performance standards for the Transitional Living Program. And we're going to start by identifying what those standards are. So the RHY rule establishes the RHY performance standards as a measure of successful outcomes for youth. They are used to monitor project performance in achieving the purpose of the RHY Act. Projects are required to collect and report on data via RHYMIS, so the Runaway and Homeless Youth Homeless Management Information System, as well as your semi-annual program progress report. Next slide, please. There are 4 performance standards. The first is social and emotional well-being. Youth are connected to a trauma-informed system of care providers to assist in promoting positive physical health, substance abuse treatment, mental health, personal safety, and reducing sexual risk behaviors. The second standard is permanent connection. Youth will experience positive, ongoing attachments to families, communities, schools, and other social networks. The third is education or employment. Youth will connect to school or vocational training programs, improve interviewing and job attainment skills, and obtain and maintain employment. And the fourth is stable housing. Youth will transition to safe and stable housing that appropriately matches their level of need after leaving the TLP, to include moving in with family when appropriate, or other permanent supportive housing, residential treatment facilities, substance abuse facilities. Next slide, please. So we're going to talk how each of these performance standards are measured. For social and emotional well-being, the standard is that grantees will enhance outcomes for youth in the core area of social and emotional well-being. This is measured by the average composite score of general health, mental health, and dental health status, that it's lower at exit from a TLP than it was at intake or entry. Next, please. The second standard is permanent connection, and grantees will enhance outcomes for youth in the core area of permanent connections. This is measured by reporting the percentage of youth upon exiting the TLP who report that there's at least one adult in their life other than RHY program staff to whom that they can go to for advice or emotional support. Next slide, please. The third standard is education and employment. The standard is enhancing outcomes for youth in the core area of education or employment. And there's 2 measures to this standard. The first is 66% of youth leaving a transitional living program will be attending school or have graduated from high school or obtained a GED. And the second is 75% of youth leaving a transitional living program will be employed or looking for work. Next slide, please. And the final standard is stable housing. So grantees will enhance outcomes for youth in the core area of stable housing. And the measure is 90% of youth leasing a TLP will exit to a safe and stable destination. Excuse me. And I'm going to pass it over to my colleague, Asita McGee.
Thank you, Rachel. I'm responsible for administrative and national policy requirements. These are very important and they help an agency or an organization to run successfully. The first one is serving youth who run away from foster care or correctional institution. The Code of Regulations, as stated here, states projects must develop and implement a plan for addressing youth who have run away from foster care placement or correctional institutions in accordance with federal, state, or local laws or regulations that apply to these situations. This is very important. Projects must also take steps to ensure that youth who are or should be under the legal jurisdiction of the juvenile justice or child welfare systems obtain and receive services from those systems until such time as they're released from the jurisdiction of those systems. Youth in these systems are not yet FISB youth until released from these systems. Additionally, TLP programs are required to increase their capacity to identify and provide services and or service referrals to trafficked youth by participating in professional training and adding human trafficking elements into existing screening and assessment tools. TLP programs are encouraged to enhance their human trafficking prevention and intervention efforts to minimize these incidents among vulnerable youth and effectively identify trafficked youth. The next slide, please. Governance and fiscal control. Organizations must have in place governance structure, fiscal control, and accountability procedures. Governance involves a board of directors or organization charter or docs that establish the governance body and responsibilities. Fiscal controls, audited financials, financial policies and procedures, which may include the structure of the decision-making process, internal controls that secure and protect funds. Staffing plan. Organizations must staff and supervise the project to ensure the effective implementation of the project plans. Staff safety. This is very important. Organizations must have safety protocol for workers. Next slide, please. Grantee publication disclaimer requirements. Grantees are advised when issuing statements, press releases, publications, requests for proposals, bid solicitations, and other documents such as toolkits, resource guides, websites, and presentations, describing projects or programs funded in whole or in part with HHS federal funds. The recipient must clearly state the following: the percentage and the dollar amount of the total cost of the program or project that is funded with federal money. The percentage and dollar amount of the total cost of the project of program funded by non-governmental sources. Next slide, please. Background checks. This is also very, very important. All RHY grant recipients must conduct background checks on all employees, contractors, volunteers, and consultants who have regular and unsupervised private contact with youth served by the organization, and on all adults who reside in or operate host homes beginning on October 1st of 2017. Required background checks include state or tribal criminal history records, including fingerprint checks, sex offender registry check, and any other checks required by state law. And to the extent the project is able to, the plan should include Federal Bureau of Investigation, FBI, criminal history records, including fingerprint checks and child abuse and neglect registry checks. Very important. Next slide. Yes. Emergency preparedness plan. All projects must conduct routine preventative maintenance of facilities, as well as have preparedness, response, and recovery plans in place in the event of natural disasters. Licensing requirement. Projects ensure all shelters are licensed, and any shelter to which the project regularly refers clients to have evidence of current licensure in states or localities with licensure requirements. Failure to adhere to licensing requirements, as outlined in the Code of Federal Regulations, may result in disallowance of federal funds. Next slide, please. Training plan. All paid staff and volunteers must be trained on the core competencies of youth workers necessary to carry out the objectives and activities of the project. Training topics must include, but are not limited to, positive youth development, trauma-informed care, evidence-informed practices and approaches, street outreach intervention, combating human trafficking and sexual exploitation, harm reduction, assessment and case management, worker safety, understanding the diversity and culture of life on the street, safe and ethical practices, and community resources for well-being and self-sufficiency. Next slide, please. Technical assistance, monitoring, and short-term training. All RHY grant recipients must participate in technical assistance, monitoring, and short-term training as recommended by federal staff to ensure quality programming and implementation to allow flexibility in which techniques will be used. Training and technical assistance is free through Runaway Homeless Youth Training and Technical Assistance Center, as known as, or as we all know as, RHY. And finally, for under administrative and national policy requirements is confidentiality. This is very important for our youth. No records containing the identity of individual youth, including but not limited to list of names, addresses, photographs, or records of evaluation of individuals served by RHY project may be disclosed or transferred to any individual or to any public or private agency, except for the purpose of research, evaluation, and statistical analysis. These records are allowed to be based on individual data, but only if such data are de-identified in ways that preclude disclosing information on identified individuals. Youth served by a RHY project shall have the right to review their records, to correct a record, or file a statement of disagreement, and to be apprised of the individuals who have reviewed their records. That is my last point under administrative and national policy requirements. Thank you.
All right. Well, it looks like we are surprisingly a little ahead of schedule before we start our break. We are lucky enough to have some opportunity for questions. If you have any questions, feel free to put them in the chat, and we will, have a little bit of time to raise them up before we go on break. And so I will give a request out to my FPO colleagues to help with answering those questions as they come in.
There is a question in the chat related to how soon the slides will be available. Can somebody from RHY address that?
Yeah, so the slides will be available after the presentation, either this afternoon or tomorrow morning. You'll be sent an evaluation link with a link that will direct you to the slide deck.
Awesome, great. So I also saw a question regarding background checks. So Sita, this was part of your presentation or to anyone. So the background checks, does that apply to counselors or other individuals outside of the agency? And I'm assuming who would be working with the youth in the program.
It applies to everyone as stated. Background checks are to be done on all employees, contractors, volunteers, consultants, anyone who has regular or unsupervised private contact with our youth or youth served by the organization, and on all adults who reside in and operate in host homes. Background checks are supposed to be done completely once anyone has contact or unsupervised private contact with the youth in the program. Does that answer your question?
Thank you. I believe it does. Thank you so much. I see a question about the agenda for the rest of today. So I can, kind of touch on that really quickly. So we have a planned break from 2:30 to 2:45, and we will go into breakout sessions for a period of 45 minutes until 3:30. And you see on the screen, you have the various group topics. So it's a surprise element. Everyone's going to get randomly selected to go into a group. One of these three topics will be the topic of your group. And we're just going to be talking about, the main question that we're posing to everyone and just getting your ideas around that. And then we're going to come back as a larger group that's planned for 3:30 to do a report out. And that's just, kind of talking through the main, discussion points that we had in our groups. And then we'll do an official closing of the event today, and that would be it. We encourage everyone to do the evaluation and all of that stuff, but that's the plan for the rest of the day. Going into breakout groups, coming together as a large group to report out, and then we will officially close.
The questions in the chat was asked if folks have ideas for tools for measuring improvement in social and emotional well-being. And one response was CANS is a good measure for social and emotional well-being. Another that I asked folks if they use is the Search Institute's 40 Developmental Assets. I think that's a really tangible and easy tool to gauge. And then where I think it's helpful is that what the research demonstrates is that it actually doesn't matter which assets you work on with young people. The more assets they have, the better they do. And so there are going to be some assets that are going to be harder to see movement on, but there will be some that you will be able to work on with young people. And so for me, I think that's a really easy one for folks at direct care levels, all levels to kind of wrap their head around and be able to engage in right away. But if you have other suggestions for your fellow grantees around social and emotional ways to measure social and emotional well-being, please do share those in the chat.
There's a lot of interesting chats about HUD eligibility for homeless, TLP eligibility for homeless. So just a lot of stuff, transitional housing, permanent supportive housing, how we define homeless versus from TLP versus HUD perspective. So just interesting, a lot of interesting chats back and forth on that.
Yes, I noticed that too, Jenny. Right, just doing a quick skim of other questions. I know folks are asking colleagues about whether they have clustered or on-site apartments. I see that popping up. And there's a raised hand from Carrie, yes.
I just wanted to speak to the HUD qualifications piece that was just mentioned. I think it's a really important thing. And as far as I'm aware, HUD standards are national. I did share a link earlier to HUD's definition of category 1 or literally homeless. And it says on HUD's website that TLPs are in fact considered part of the category 1 definition. So would be able to qualify for rapid rehousing. This is news to me, and I think it's really game changing. So I'm gonna go ahead and share that again because I think it's really important.
Just to add, if I can add to that, it doesn't say TLP, it says transitional housing. And so I think as far as we've been told, there's a difference in how HUD views TH and how DHHS recognizes TLP. And so the fact that a Cat 2 can walk into a DHHS TLP, you cannot become a category 1. So I think that the semantics on transitional housing versus TLP and how they're different in funding sources, according to our monitors in Connecticut. So we've been told, yeah, if you enter as a Cat 1, you can retain that. If your crisis is not resolved when TLP is ending, you could go back onto your local registry, but you can't come in as a Cat 2, become a Cat 1, and get back on the registry. If that makes sense.
I'm in Chicago, Region 5, and I believe that last statement my colleague made applies here too. I don't believe you can go the reverse way. You can't come in a category 2 and go back to 1. So I think that might be universal. I'm not sure. Other folks here could have to confirm that, would have to confirm that. I'm not really sure. Thanks.
Thank you all for that. This is an awesome opportunity for information sharing for sure. So we appreciate the links and the conversation. I believe I see one last question. Do any of the MGHs, a question to peers that some folks have started to answer, do any of the MGHs accept pregnant or parenting youth of other genders, or do they have to identify as women or mothers? So there are a lot of folks who are saying, yes, they accept both male and female parents. So I don't know if anyone else also wants to chime in or unmute themselves about what their TLP MGH accepts, whether they accept moms and dads.
Yeah, in Kansas City, we accept moms and dads and couples.
Right.
Are we supposed to write it in the chat, or is it okay to speak? Can anyone hear me?
Yeah, I think she said you can come off mute and share as well, or chat, either way.
Okay, I was gonna say here in Minnesota, moms and dads and same-sex couples are welcome. for housing and shelter.
And I see the distinction is also the question is about non-gender binary folks. So are there any programs that are serving trans youth or non-binary young people in their maternity group homes? It's looks like Mimi Daniels is serving everyone. Yay.
Awesome.
We did have a trans youth, female to male, that was in our maternity group home.
Great. And thank you for that clarification. That's important. Awesome. There's another one who's serving everyone. I love that. Love that.
With that, is there any additional programming or community education or anything that you folks are doing in relationship to maybe other providers that might not be as accepting or recognize youth of non-binary genders in your programs?
Are you saying like community education? I guess it is that what I heard? Well, I know Mimi's on the call as well. We work together. So I will start by saying so the way that we post this post for the units shows that we are accepting of all. So that is one way of letting folks know that that's how we are, advertising our open and available spaces. I also know that we have a director of quality and engagement, and I know that in the last 6 months, I was on a panel as well, to talk about LGBTQ plus community and the ways that we reach out to our young folks and ensure that we are leading youth voice and acknowledging that within our programs. And we do that by focus groups and surveys and check-ins. It really starts from intake, hearing what is the need. And so that is how the evolution of all things have happened. So maybe you could probably speak more to it as well. Do you have anything else?
Right. Keep the questions coming if you have them in the chat. Also, if you think of a question while we're on break, which we'll be taking shortly, feel free to continue to, put those questions in the chat, because our goal is to capture all of that and be able to produce a transcript of the questions and answers to everyone who joined us today. And I see a lot of folks that are talking about their branding and social media, which I love that.
You're also talking about not just CANS, but other mental health assessments like PHQ-9 and GAD-7. So lots of good assessments out there.
Yes, for sure. That's great. And this is a great opportunity to connect with your colleagues. I'll say again, within the chat, exchanging, information. We've heard some really great highlights today from, programs that, have some really great ideas for engagement, for, transition planning. So feel free to, reach out and, connect with these folks to see how it can be implemented if you find it, useful for your organization. We definitely encourage that. And that is a huge part of, why we wanted to get together today. Outside of the training piece, it's also, really connecting with each other. All right. So I want to do the report outs. I know in particular, I was part of the partnerships and service coordination. So I guess we can go in that order. And I can start with, just some high level things that came out of my group. So I heard a lot of really great conversation about just areas really coming together, groups of service providers coming together. Our main question was, how has your organization built authentic and meaningful collaborations? And I've heard from a colleague in Detroit who talked about, just groups, landlord luncheons, which I love. I just named it that, that come together to talk about, young people and, being able to help young people with, kind of starting out. A lot of the young people that we are working with, they don't have a rental history, they don't have a credit history. So being able to just kind of share, ideas, talk to you directly. And it's coming, talking directly with landlords, with staff, with youth, all coming together. Also, I heard a lot of task forces or work groups that have started from like the mayor's office level that consist of other service providers, other, agencies within, the jurisdiction, really coming together to talk about, how they can help support young people who, really could very well touch all of their programs and all of their agencies. One thing that was promising was that one of our colleagues actually said that, they've kind of done away with the competitive spirit of, providing service, linkages and support. And they really are, if I don't have the room to take you or to take on a youth, I will, pass along to another agency that works with the same population. So that was really promising. I've actually, we talked about, the consistency of the meetings. Folks are meeting monthly or, every other month to talk about these issues, which is great. There was actually also conversation. New Mexico, our colleagues in New Mexico were actually talking about youth being able to, choose a group of supporting, supporters in a sense to build around them. So a team that the youth really selects themselves that consists of service providers and being able to, really link them to the services that they are choosing in that moment. And lastly, we really just talked a lot about the opportunities that are there in different areas. We did have the question of, has COVID, played a role in either helping or hindering partnerships? And, some of us, did acknowledge that, it helped in a way that prior to this, in this virtual posture, it was hard to get a group of service providers together in one room, physically in one room. But, in this instance, we've had as many as, 50 service providers in one room. I think one of our colleagues talked about, the meeting consists of 50 people. And, we commented that, that never happens, in being physically in the office. So it was really a promising discussion, that we talked about. And, it really seems like folks are finding a way to have and build and maintain a really strong network for the young people that we're working with. So I will ask, drumroll, Jesse, did group 3, what points did group 3 come up with?
Thanks, Deanna. Yeah, we talked a lot about collaborations as well, and housing was a focus. So, we talked about a lot of challenges with housing partnerships and the fact that there's, not a lot of affordable housing, and it's really challenging for youth once they graduate and transition out of programs. But there were also some good examples. So a program in San Diego talked about their systems navigator, and some other folks talked about agreements with landlords. One or two programs talked about, really finding that landlord or that property management company that could buy into your program and understand the mission. and kind of innovative approaches. One person had someone on their board who was a landlord, who was open to, having more agreements with their program. So just broadening that partnership. We also talked a little bit about kind of knowing your community and creating partnerships developed, based on that. One program in Minneapolis talked about the impact of George Floyd on their community and the trauma, and both for their staff and for their youth, and really developing partnerships in their community around that since that happened. And lastly, I asked about, what kind of FISB supports, and, definitely increasing the funding was a support that we could do. But also, just looking at different rate increases. But mostly it was similar to your discussion. It was very helpful, and I appreciated everyone sharing.
Thanks, Jesse. Tim, did anything come from group one?
Yeah, thanks, Tiana. And there was a lot of similar conversation to what you and Jesse had discussed. But I do want to add a couple other points that came up. And a big one was having the partners meet the youth where they're at. So this was especially helpful with single sites as opposed to like a host home or scattered site model, where a partner that the youth was being referred to could actually come to the site, meet the youth with the worker present, things like that. And that really helped with the warm handoff. And that was for a whole range of partners, whether it was childcare or parenting classes, things like that. But also mental health counselors, things like that, that would come on, these folks would come on site. And another big item was just the idea of exploring or reaching out to somewhat non-traditional partners and working with volunteers in kind of non-traditional ways. And a big example was reaching out to a university hospital network in order to basically open up like speaking to their behavioral health clinical department and having a clinic that was just for their kids for initial, whether it was mental health screenings or things like that, and being able to refer out from there or maintain that therapeutic relationship with the youth. And another big one that I really liked hearing about was partnerships for, a basic life skill for teenagers is learn how to drive. And so having partnerships with driving schools and looking into volunteers that, can pass a background check and have a driver's license that can help the kids get their hours. And then with the challenges, so some folks had mentioned the idea of just putting challenges out to the COC. This is a challenge that we're having, whether it's finding housing or partnering with a resource, whatever it may be, and finding out that by being involved in COC and these other community partnerships, a lot of those resources are there. We're just, siloed enough that you don't necessarily know about them. So being involved in the COC, doing the pit count, being on subcommittees, things like that, helps build those connections between workers that can then help the youth. Thanks.
Thanks so much, Jesse and Tim. That's awesome. You guys, the groups did a great job on partnerships and service coordination, and it seems like a lot of valuable information came from that. Now, the next topic that we had talked about aftercare, which is also huge. So I will invite Asita, Jenny, Rachel, and we can go in that order to talk about what groups 4, 5, and 6 talked about, and as it relates to aftercare.
We had a robust conversation, and I tried to take notes, and please forgive me, everyone, if I didn't capture 100% of everything that you said. One of the things one of the attendees said is from day one, housing options, whether it be going to a TLP, rapid rehousing, possibly family members in other states, to establish sustainability they do this from day one, and it's done 3 months before the youth leaves the program. And they build connections even after 3 months. So no one has to limit the aftercare just to 90 days or to 3 months. Another comment was made that Grantee says that they create a Facebook page for aftercare so they could keep that connection going. Grantee stated that when the youth come in, many of them don't trust anybody and they have to build confidence. And what I thought was very touching and to me very sad that many of us take for granted is that the youth are not accustomed to having success. And eventually they re-sabotage themselves. So they work on building confidence so that they could get accustomed to being successful. This is something that was addressed in my part of the presentation on confidentiality. One grantee said that grantees have to be careful with exposing everything they know about the youth to everybody on staff. He mentioned that it's on a need-to-know basis. And when you do that, it does not build trust with a population that already has trust issues. Another grantee spoke to aftercare being for 2 years. And one grantee said that they, in their organization, they have a lot of services in the building. So they still are able to follow youth and keep in contact with youth. One grantee said that they have youth that are on their board. Youth are engaged in policy changes because of their lived experiences. And even those youth who are on the board addressing LGBTQ issues. One of the things that, just to make it short, because there are many other people here, one grantee would like RHY to help them since they had hired an aftercare worker, lost funding, but they still are doing it. They would love to find out how they could become more tech ready to meet or social media savvy to meet youth where they are in using social media. And this is something that I think RHY could help all of our grantees with. So it was a wonderful opportunity to hear from the grantees, and I thank everyone for this opportunity.
All right. So I'm group 5. Thanks, Asita. And we also had a wonderful and an engaging group, lots and lots of great ideas and solutions, as well as sharing of barriers and challenges so that we can all help each other. So what we've heard is strategies for aftercare, sending letters within 7 days, utilizing social media and texting, as well as, giving them bus passes and other like gift cards, for other things they need, like clothing or diapers or, whatever they need to stay in touch. Also, a lot of just great relationship building. I think that's really critical to have the youth stay engaged with their aftercare staff. And then with that, we heard some really good examples. We heard from, for example, Mountain Home did share their open table model at this session. The table of 6 to 8 community members, they would come and they would build connections, they would teach and learn and grow through open table, and they would just provide all kinds of resources for the youth for aftercare, such as transportation, car repairs if they need like a car mechanic. They work with like the police officer and build a relationship with them. So just so many great examples about open table. We heard like other grantees talk about like rapid rehousing and, having access to landlords and like their apartments, such as like 360 youth services and so many others. Grantee and I believe in Kansas has like an independent, in the city of Independence, has like an independent like a housing authority that they work with, where they provide like a project-based voucher, which is like a Section 8 housing voucher, so that like the rent doesn't go up. They don't need to pay additional or more rent. They just kind of qualify, and then they stay with kind of that same income, which is great. Another grantee mentioned, I think they have like 7,000 like apartment units in their building. So like it's such an easy transition for those youth to get affordable housing already within, and to get discounts on their rent and all kinds of incentives with their 18-month rental history and their length of stay, to be able to stay and, stay with that income criteria so that it's affordable. So just a lot of great stuff. We heard from another grantee whose youth who would exit and now allow other youth in their program for TLP take a tour of their apartments, after they exited, so they can see what it feels like and visualize what it feels like, when they move into their own apartment. So all kinds of great examples. Individual development accounts is another great strategy we heard, where they can have savings with a match and can money toward college tuition and cars and whatever they need. We also heard challenges of like staff retention was a big challenge of just staff turnover, with COVID and all those other things, and, burnout and the equity of pay, is hard. So just trying to kind of, keep up with that with the staff. But, on the other hand, we're also hearing great things too, like overcoming, having like an outside therapist come once a week, on site to keep with those accessing to resources, and all that good stuff. So thank you, everybody. It was a very comprehensive and engaging breakout.
Awesome. Thank you so much. And Rachel, did you have any additional points that came up from aftercare that you wanted to share?
No, our group, again, had a great discussion, had come up with a lot of the same things that have already been shared. I think the thing I would like to highlight is just the ongoing conversation about positive youth development, really helping young people build those connections with their landlord so that they can transition to their own leases, feeling confident accessing resources, feeling confident asking for help.
Absolutely. Thank you so much for that. And I have the pleasure of passing it on to the last set. So that topic was around data management and the 4 core outcomes, which is super important. So I will, I guess we can go in the order of Maya, Rebecca, and Tom to share what their groups came up with.
Hi, everybody. This is Maya. Just wanted to share, we had a lot of great discussion in our breakout. Essentially, we spent a lot of time talking about different self-sufficiency matrix and different tools that grantees were using to assess social and emotional well-being, as well as sort of functioning along the 4 core outcomes. So folks shared those, and I'll be sure to include those in the notes so that RHY can share them out as well. Some folks were asking about how to engage and what that looked like. And so we talked a lot about incentivizing those engagement and those touch points. And then in relationship to data management, there was a real range. Some folks are able to dedicate staff that are part of a quality assurance committee type thing. Some folks do that sort of more randomly throughout, and others have like a strategic planning process that incorporates an evaluation of data, and also timelines for when data is due and things like that to do checks. So there was more talked about, but I'll leave it there for the other groups. Thanks, guys.
Hi, it's Rebecca. So our group had a great discussion as well, and I appreciate all the comments they made. I just wanted to highlight basically what we discussed was a lot of what Maya said. But I did want to point out a couple of things. One program, Rachel at New Beginnings in Maine, she said that for quality improvement, and I hope I'm not misquoting her, what they do is they train staff they cross-train staff in all of their programs. And then another interesting thing that I picked up was during COVID, since that was one of our questions, one of the staff, and that was a young lady, Shannon from New Mexico, she said basically they kept just doing what they had been doing prior to COVID, and you know, staff, even though there were, despite staff shortages, they just continued and made sure what they had already planned, they continued doing. So they didn't skip a beat. All right, Tom, take it away.
Sorry, started talking without the mute on. Thanks. Our group had a good conversation. Our biggest thing was data collection. And, you know, HMIS is our reporting system for data, but to get quality improvement out of it, you have to have, you know, internal collection systems because it's not working through HMS to get what they want. So there's various ones out there. There's Apricot, the WISE-PDAT, ETO, Social Solutions, Best Notes, Excel. Some use Excel. So there's a very varied method out there to collect the data, and then to get the data into shape, I guess you'd say, for data quality. Pretty much common theme was there's too many chefs in the kitchen handling the data, and it seems to get more and more difficult to get the corrections done and uploaded. And that could be what I didn't ask, I probably should have, was like maybe a specific COCs that have that issue or may not, I'm not sure. But the data is used, you know, CQI, some people have had to hire specific staff to do number crunching in CQI so they could do the weekly, monthly, quarterly staff sit down on where are we going, how's our logic model looking, are we making our goals? And probably like everybody in the country, staffing has been an insane issue for everybody. It's causing, you know, they have to start triaging what they can do in a 8-hour, 10-hour, 12-hour day. So some things get put behind and others. So it's very hard for these agencies to maintain good data in the middle of a pandemic and staffing shortage. But most of them are doing well. Their staff are well involved. One agency has their staff involved in reviewing RFPs. So it gets good buy-in for the staff. But overall, they're doing data collection the best they can with the tools available. There is no tool that does it all. So they have to do double entries, which, you know, that doubles your chance for data errors. So that's something maybe RHY could look for as a tool that does it all. But that's it.
Thanks so much. Well, thank you, everyone. I think what we took away from this is that we have a lot of stuff that we can follow up on, questions to answer, and, you know, resource links to, you know, be able to provide for everyone. But I really appreciate the discussion, appreciate all of our discussion today. So as we are getting close to closing time, I want to hand it over to the RHY director, Dr. Sanzana Dean, to officially close us out for the day. So Sanzana, if you're on, feel free to take us home.
I am on. Can you hear and see me?
Yep, sure can.
All right.
Can now.
Well, thank you very much, Tiana. And good afternoon, everyone. I'm Dr. Sanzana Dean, the Director for the Division of Runaway and Homeless Youth in the Family and Youth Services Bureau. And I'd really like to take a moment to thank you so much for joining our training today. I hope that you found the format and the material covered to be useful in enhancing your knowledge of program requirements and best practices for implementing your transitional living program. This program-specific training series was developed based on feedback from you, our grantees. As part of our new grantee orientation last fall, we heard through the post-training surveys that while grantees found the information useful, more time was needed to cover more in-depth program-specific information. So this training series was developed to respond to your needs and to provide a deeper dive on program requirements for each of the 4 RHY program areas. I've truly enjoyed being a part of your training today.
and can see the commitment and passion for youth that you have, which is really evident in the robust discussions, the thoughtful questions, and the intentional sharing of best practices. We had over 450 participants in attendance today, which speaks to your interest in receiving this type of training. In one of our groups, there was even one gentleman who was 4 days on the job. So I would say that today's training is truly perfect timing, and hope that both new staff as well as staff who've been implementing these programs for quite some time learned something new or took away from something in the sharing with your colleagues in the field, a best practice or a way of doing things or information about data and research, or even tools that you can use in conducting assessments, providing aftercare for young people, and just anything that you may not have done before coming to the training, but might consider using or thinking about, in the days to come. So with that, I would like to thank our Associate Commissioner, Kimberly Waller, for offering opening remarks and sharing her priorities that guide the work that we do each day in FISB. I'd also like to recognize the efforts and the commitment of my awesome RHY team, who worked diligently over the last several months to plan and lead this training with support from the RITAC team at Youth Collaboratory. In addition, I'm thankful to each of you for the work that you do each and every day to support runaway and homeless youth. And I look forward to hearing your feedback on how we can continue to bring you a variety of new training and technical assistance offerings throughout the year. I invite you to join us for our training on Thursday for the Street Outreach Program specific training, and to complete the evaluation for today's training. I will turn it over to